You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Wisconsin's go-to implant dentist, Dr. Greg Cochrane. Dr. Cochrane, welcome to the program.
Thanks for having me.
Now, and I know you have 4 different offices and a huge team, but for people that don't know your practice, like who's the typical dental implant patient that you see?
So we see a wide variety of patients, but the typical implant patient that comes in to see us tends to fall into one of 2 groups. The first group of people are people who are coming in and they have teeth, but they have bad teeth, bleeding gums, loose teeth, missing teeth, maybe their front teeth are splaying out, and so they're unhappy with, and maybe they were driven in because they've got something that hurts and something that's painful, and so they're in our office. But they're terrified of losing their teeth, and they're terrified of getting dentures. So
they feel like they're going to end up in a denture.
Yes. And maybe they've been told that by another dentist, and they're said that dentures are your only option. It's where you have to go. So they've started to pursue what options they might have and who they maybe might feel most comfortable with. And for those people, they come in and we get them excited and inspired about a different route other than dentures. And that's coming in and getting a brand new set of upper and lower teeth that are secured to dental implants. So they've got a brand new set of teeth.
All right. And what's the second group?
The second group is people who come in and they already have a denture. These are people who, they went through a long history of dental problems and have lost their teeth, and now they have dentures, and so they kind of have closed that chapter on their life of thinking that they need to go into the dentist. But maybe they come in and they've got a sore spot, and that's what they're thinking that they're going to fix. And we can ask them, are you happy with the dentures that you have? Are you happy with your smile? Are you happy with how your day-to-day existence is with these pieces of plastic that are meant to function like your teeth? So for those people, we can give them a life-changing transformation. We can take them from coming in on one day and they have no teeth, they've got the dentures, and they leave with a new set of teeth that are fixed, they don't come out, and they're a whole nother way of going through life.
Is this the future of dentistry, whether it's like 20 years or 50 years, that dentures as we know them today will be gone? That means they'll all be attached to something? What are your thoughts?
I think that dentures are this lingering holdover from history that is no longer appropriate for people to have nowadays. Nowadays we have dental implants, and dental implants that are predictable and safe, and they're there for your whole life, and they can anchor teeth so that you've got a new set of teeth instead of this big bulky piece of plastic that's in your mouth that doesn't stay put. It moves around, it gets sore spots, it doesn't talk well, it limits your ability to taste.
So you could probably help the denture wearers the most, but you can't get them in, you said.
Yes, we can help them.
Because they don't go to the dentist, right? That's what you said.
It's hard to get them in until something is going wrong and that they feel like maybe they lost a tooth in the denture. But then it's an opportunity for us to help them and really talk about, here's where you are and here's where you could be. So my father was a dentist. He retired at age 79, and for him, this wasn't an option to be able to present to patients. This is new technology, new digital dentistry that drives what we can do today. And so dentures are really this old paradigm of how we can fix people and give them a new set of teeth, but they're not teeth. They're just pieces of plastic.
Now, we've talked on the phone. It's almost like a third set of teeth. You got your baby teeth, adult teeth.
And for people who need it, it's their next set of teeth.
And if they take care of them, that means going for checkups. I mean, they should last as long as they last. Is that true? It's
so predictable, and the protocol and the process that we use called Hybridge, there are extra implants built in. So meaning like if something were to go wrong at some point down the road. So really the intent is that this is your new set of teeth that's meant to be there forever. So it's outstanding, and it chews and it functions and it increases your quality of life. That's different than if you have this. If you're a denture wearer, you wake up in the morning and the first thing that you do is you squirt a bunch of pink goo on the inside of your denture and then try to have that keep it in place during the day. But you're tasting that all day long, and so this is a whole nother avenue. This is not something that you're trying to get it to stay in place. It's fixed and it's always there, and it feels just like your natural teeth. So that allows you to chew better and taste better and have an overall totally different quality of life.
Would you say there's thousands of people? Within 100 miles?
Tens of thousands of people.
I mean, people... They're all over the place.
Within a 100-mile radius of our 4 offices, there'd be tens of thousands of people. You could fill I mean, you could fill Lambeau Field Stadium with people who have, are missing more than 9 teeth. I mean, statistically, nationwide, there's more than 60 million people that are missing 9 or more teeth. People who are wearing dentures. You could fill, there's tens of thousands of people that are missing.
Just in Wisconsin?
In our region. Yeah, I mean, this is really common.
Okay, if it's so good, why aren't they all doing it? They just don't know about it?
We've kind of pinned it down to 5 main reasons why somebody doesn't know about this already. The first reason is, let's say they have a denture and they have been through this course of life of dental trauma and problems and pain and frustration, and so when they get a denture, they've kind of closed the book on assuming that they need to go see the dentist, and so they just don't know. They were never presented that as an option, or because time and technology has advanced, and so now we have this ability to do this procedure, really simply and quickly and safely. So they just don't know.
Okay.
Reason number 2 is they think that they don't have enough bone. Maybe they've been seen by other dentists.
But it is true, isn't it? I mean, if you've been wearing a denture like 10 years, you can't do this, you don't have enough bone.
Absolutely not.
Okay.
With the 3D technology that we have nowadays of all the scans, it's something that we don't need to worry about because almost everyone is a candidate for this. So, so it's not usually one of our concerns. So that's one of their that's one of the issues, is that they feel like they may not have enough bone, and that was because that was what they were told by another dentist. Another reason is because they think that they're too old.
Yeah, how old can you be? Like, what's the upper range?
We have the oldest person that I have done this with is 91.
Why would a 91-year-old want to do this?
If you're 91. People in that stage of life are oftentimes, life revolves around socializing. So that's eating and talking and chewing and being with your kids and your grandkids. And so what you have for your teeth really matters. And little kids are, I've got 3 little kids. I mean, they'll tell you anything. And so, we've got grandparents that'll come in and they'll say, Grandma, why do you have bad teeth? Or why do you have that tooth that's missing?
Right?
Yeah, and so this lady who was 91, who I told you about, she came in. She was sitting in the chair, and we're sitting in front of our windows and the sunlight, and I was presenting her, with what she had going on and what are her options, and she looked at me and she said, "I didn't get to be 91 by choosing the cheapest option for my health."
Okay.
So she elected to go the route of a whole new set of teeth. And when she got done, she was like, that I should have done that so much sooner. Like, why did I go that whole long road of missing these teeth and struggling to chew and having these issues, and I'm so glad that I went through this. And she was a lovely lady.
So before she got to you, was she wearing a denture or just had really, really bad teeth?
No, she was missing all of her back teeth, and so she only was chewing on the front, and the front was all breaking down now. And so it's moments like that where there's a transition where we have to decide what are the roads that you could go down, what are the advantages and disadvantages.
So she gets upper and lower teeth at 91 years old.
Yes, sir.
That don't come out.
Yep.
And she can eat whatever she wants? Like once it's all healed up, it doesn't matter?
Yeah, and if you're 91, the thing is oftentimes we'll get people that'll come in, the common, pushback we sometimes get is, well, I'm 50 years old, or I'm 60 something, or I'm 70 something, or 80 something, whatever, and people somehow think like, I need to be a certain age for it to be appropriate to take this road or not.
But if you're 91 years old, it seems risky. Like, aren't they more likely to fall out?
Absolutely not. Nope.
So even if you're 91.
Even if you're 91.
The bone just grabs onto those implants.
People's bone is healthy. Bone is a good thing, and it's and like we said, you don't need that much bone in order to place these implants and make this kind of transformation happen.
Now, but what about the people that have bad gums, like gum disease? Those people can do this?
Those are the people that
or aren't their gums too bad to hold the implants?
No. So the gum disease just mostly revolves around the teeth, and so those are the people who are coming in that we're excited to take care of, because they're coming in and they've got gum disease, they've got missing teeth, and they're frustrated and scared, and so the gum disease goes away when the teeth come out, and so
it's a bacterial infection.
It's a bacterial infection.
So
it's around
it lives
the teeth,
on the tooth root or something.
Yeah. So the bacteria, it's a gum infection. It's a bacterial infection that's around the teeth, and when the teeth come out, and on the day of the procedure, we clean up the gums, clean up the bone, and place the implants. Things are healthy again, and we put a new set of teeth on top. And that worry and that frustration and oftentimes what people will see is they'll come in and afterwards and they'll say, you know what, I can't quite figure it out, but I feel significantly better. And it's because their body isn't fighting that bacterial infection. I mean, they say that the surface area of that attachment to the tooth is about, like this is one for people who have all their teeth, is about the size of your palm. And so if your body was fighting the size of an infection like on your palm all day, every day, it takes a toll on your immune system. And so
so you get rid of the bacterial infection, they feel better, more energy.
They feel better. They've got more energy, more vitality.
So I think you were the one that told me that you can't brush and floss out a bacterial infection.
It takes,
because a lot of these people are trying their best to keep their teeth.
They are, and it's well intentioned, and for people, it depends on what stage it is. If it's fixable and we can keep people with their teeth, that's what of course we're going to try to do. For people where the gum disease is so advanced that it's not going to be a great long-term prognosis or likely future to keep their teeth, then we just say it's okay. We can, the teeth just need to go. It's just kind of the only route. But we don't. We tend to not lead with the route towards the denture. We just want to talk to, because we're passionate about getting that person to a great place in life, and that great place in life, is around having teeth.
But what about pain? It seems like a painful thing.
What
do patients say?
People are scared about that issue. They're coming in and they're worried about that, and there can be some discomfort as a part of healing afterwards. But during the procedure, they're numbed up. We're just kind of wizards with the anesthetic nowadays. There's a whole menu of anesthetics.
Okay.
And we've got a team of CRNAs that do the IV sedation. So, for this procedure, people are...
That's like a nurse anesthetist?
Yep, a nurse anesthetist. They work at Mayo and they work with us.
So they're like IV sedation, they're looking at their vital signs?
They are dedicated during that procedure. So we as the doctor are dedicated to, the procedure and the outcome, and we're focused on that and on you as the patient. But the CRNA, the nurse anesthetist, is focused on your sedation. So they're monitoring your level of sedation and making sure that you're safe and comfortable the whole time. So it's never an issue to have to worry about something hurting while we're doing the procedure.
What about oral sedation? A lot of guys are doing that.
Yeah.
What are your thoughts?
There's some good and some bad with oral sedation. We don't go in that direction. Because we believe in the ability to do the IV sedation, and you can dial it up and dial it back down, and it's safer. And because then you don't have to have there's no sedation before we even get there. So it's about building the trust and confidence between the patient and our team.
So I guess you have lots of doctors, and you have 4 locations. Where are they, by the way? And do they all do dental implants?
They do. All the offices do dental implants. We've got 8 doctors, and 5 of those doctors are committed to the latest and greatest in implant dentistry. So no matter which office you would go to, you can get the same level of care. There's consistency. Arcadia, Wisconsin, Holman, La Crosse, and Viroqua. So they're kind of lined up north to south along the Mississippi River. But people will come across, from southeast Minnesota, from northeast Iowa, and from southwest Wisconsin. So we kind of pull, because our reputation is synonymous with exceptional care and exceptional experience, people will come to us for that experience regarding dental implants.
So with you, do you think you'll focus on just implant dentistry and leave the general dentistry to some of the other doctors that work with your team?
Yes.
Is that correct?
Yes. Okay. Because I lean into what is most fulfilling, and to me, to listen to a person who is dealing with a denture or dealing with a smile, and teeth that they don't like and they want to transition, there's an enormous power in the ability to get that person to go a different direction in life. Because if you've got a different smile, you've got a different lease on life. You are more confident. It's linked to your charisma.
It doesn't surprise me you say that, because you're a dentist. But how important do you really think a smile is? Or good teeth and gums?
It's not just because I'm a dentist. It's that the smile, that the studies show and the surveys show that a smile is critical to how we view another person. So if you say, what are you looking for in a spouse? That's a Men's Health survey questionnaire that they did, and smile was the #1 answer.
Okay.
Or what do you remember about a loved one after they're gone? Smile is in the top 3. Or what do you find attractive about another person? Smile is in the top 3. So it's really, and the scientific studies will show that, if you've got a healthier smile, you're smiling more, your levels of stress are lower, your your hormones that are, controlling your body are less in a state of stress, you're healthier, so you're more likely to live longer. So there's science behind how a smile, is a part of how we relate as humans. But I think the real gold and the real impact behind a smile is how it's tied to someone's sense of self, their sense of self-confidence,
their charisma or their self-esteem?
charisma, their own sense of self-worth. And so, I mean, if you're going through life and you feel like you need to hide your teeth and hide your smile, like you will feel.
Do they tell you
like
that on the consult, by the way?
They do. I mean,
like they're ashamed of their teeth.
I mean, there's
Okay.
one of the ladies there's a great powerful example of this. Her name is Janet. I took care of her, and she came to us because it was literally related to her smile. So she came to us, and her energy was low, her sense of self was low, and it was all related to her smile. And she said, I'm recently divorced. I'm eager to date again, and my ex-husband told me that I have horse teeth. And she's a lovely lady, and she has normal teeth like you or me, and. But it was psychologically, there's a sense of self that's tied to her smile. So we got her a whole new set of teeth and this beautiful, gorgeous smile.
Nice.
And now she is a whole nother person. She's flourishing. She has bought a real estate business. She bought a farm and is fixing it up. She's dating again, which is what she wanted. I talked to her the other day. I saw her in the office, and she was smiling and laughing, and she's just this totally different person.
Do you ever misread people? Like they come in one way, shy, reserved.
So
they get
different.
their new teeth, and all of a sudden they're
so different. And I said, and I asked her. I said, could you tell me how us fixing your smile has changed your life? And she said, I felt like I wasn't seen. I felt like I wasn't worth anything. I was unworthy. Wow. And so now with my new set of teeth, I feel seen. She's now a keynote speaker.
Is that
I mean, that's the difference in confidence and self-worth and the word charisma. But it really translates to an entirely different way that somebody goes through life. So that's why I get passionate and enthusiastic about this, is because somebody who's dealing with painful gums and missing teeth and if you're a man, maybe you're growing out your beard and your mustache so that you cover up your teeth. I mean, there's some subconscious psychology. What's that?
I mean, you hear that from patients?
Yeah, I just had a guy tell me last week. He said, we're in the process.
Of giving him new teeth.
Of giving him new teeth, and he literally told us, like, the reason why I have this beard and I have this mustache is because it's covering my teeth, because I don't want to smile.
What's it like when it's all done and they look at their smile for the first time in the mirror?
They can't believe it. I mean, it's something that they haven't been able to imagine themselves with beautiful, natural-looking, healthy smile. It's something that's been deep-seated, that they've always wished, like, well, that's not me. I don't have that. I have this. This is what I have. I have this smile that I hate.
So they get choked up when they see themselves. Does your team ever get
the tears come down?
Choked up?
The gals in the room. I mean, there's a strategically placed box of tissues, because the tears just start coming down and the hugs start coming out. I mean, secretly that's what we're all waiting for in the room, is that moment when they look in the mirror and they see a new person that's got a beautiful smile.
How soon can they eat when it's done?
They can eat that same day. They can go out and they may not be chewing crusty loaves of bread, but it's soft foods, and before you know it, they're eating corn off the cob.
So they can eat whatever they
popcorn.
want.
Yeah.
Even with their front teeth, could they bite like a raw
anything
carrot?
they want. You treat these as if you've got beautiful, natural, healthy teeth from back when you started.
So when it's done, what do they like more? The way it looks, or all the foods they can eat?
It really varies depending on the person that comes in. There's some people that come in and they're wanting the looks changed, the appearance changed, and by the end, they're saying, well, gosh, I do love the way that it looks. I've got a beautiful smile, but now I didn't really remember what it's like to be able to chew and eat anything and not have fear that my teeth aren't going to come out. And so, It varies depending on the person. And so there's one guy, Bill, who we treated, and I asked him, what do you like most about this outcome that you've got? Is it your smile that looks outstanding, or is it the way that things chew? And he said, for me, I was always afraid that anytime I would bite into something that I was going to have another tooth that broke. I mean, before we started, he had, really worn down, chipping teeth. Things had been ground down a lot. A worn tooth sort of case. And now he's like, I don't need to worry at all.
You say people with bad teeth are judged. Elaborate on that.
What our patients will tell us will be that when they're standing close to other people, they feel like they can't. They feel judged. They feel, dirty or unclean, or that their breath
like the person's looking at them like
they feel that the other person that's next to them is judging them. I mean, and I think that's subconscious in our society. I mean, if you're making a movie and you want to make a villain, you give them bad teeth.
Okay.
They're synonymous with being dirty or unclean, and so that affects relationships. That affects your, if you're feeling willing to kiss your spouse because you're worried that they're gonna. That you're feeling self-conscious, you're feeling judged, that you have bad breath, and so that's why this is such a.
So the bad breath goes away because it was the gum infection causing the odor?
Yeah.
Really? How soon does it go away? Right away?
Immediately. I mean, as soon as the teeth go, the bad breath, the gum infection goes. It's that day is the transformation.
So we're short on time, but for the two categories of patients, they still have their teeth, but it's been determined they have to be removed, or the patient that's currently wearing a denture. What are their options when it comes to implants in your practice?
Great question. People, because this is the common conversation with people, is to say, what are the roads that you could go? What are your options? And so getting a set of dentures is an option. Okay. It's not an exciting option. It's not where we try to steer a patient. Then there's the option to place. So if you're talking about the lower jaw, you could place 2 implants right here. And that's a snap-in, snap-out denture. That snaps on, and it still wobbles in the back. It still can move around. There's constant maintenance. You got to come in, and it'll still need what's called a reline of adding some pink plastic underneath it. It'll always need new O-rings, generally about every 6 months. So it's kind of this constant thing, and it's still
so
a denture.
You're not a fan of those?
No,
like.
I mean, I'm not a fan of them because patients aren't that much of a fan of them.
Because it's still a denture.
It's still a denture. It still moves. It still takes. It's not an exciting outcome.
So snap-in, snap-out dentures is one option.
It is.
What's the next level up?
So the next level up is a number of implants. So we do 6 implants in the upper jaw or 5 in the lower.
Okay.
And a set of teeth that gets put on top. And so there's no extra plastic that's covering the roof of your mouth, so you can talk and chew and taste normally. So it's fixed and it's always there and it doesn't come out.
Now, correct me if I'm wrong here. The way dental implants are typically done is in 2 different places, maybe 3. You go to one place that does the surgery, another office that puts the teeth on top, and another one that cleans them. You do all 3 parts. Is that why you do it so quickly?
So quickly, and then we can make sure we control the entire experience and the outcome. So there's one doctor, one fee, one team, one relationship, and this is at any of our 4 offices. And so we just believe that approach is the best approach because it keeps the cost as low as it can.
Right
the
there.
Patient, there's trust. There's not confusion about who's going what and what the timeline doesn't get dragged out. I mean, it's typically in other offices it's 6 to 12 months. In our office with this protocol, it's in as short as 4 visits or 3 weeks, 2 to 3 weeks.
Okay, so somebody watching
really
this next month they have new teeth.
Absolutely. I mean,
it doesn't matter the age.
Nope. Same process, same protocol. Super quick. So people find the right time in life to be able to do this, and it's a quick transformation in 1 month.
Okay, now insurance and lots of questions about the cost of implants. I guess even the best dental insurance you say doesn't really cover this. Medicare, Medicaid doesn't cover this. People are financing this?
People do. About 8 out of 10 patients finance this. We partnered with a really great financing partner that we feel like we can trust. And
you have to have okay credit?
Yep, halfway decent credit. Most people get great credit financing as up to 10 years. So that makes for really affordable monthly payments for people, so that they can make this happen for them. But some people, they've got, everybody's different. Some people will come in, maybe they took out a HELOC or a line of credit on their home, or some people have a parent or a significant person in their life that they can go to, and they'll help that person, with the cost of this treatment.
So no more dentures. We said that at the top of the show.
No more dentures. The dentures can go away.
We are out of time. So final message. Let's say that the 2 categories, people that have really, really bad teeth, They know they don't want a denture, or the people that are currently wearing a denture, they've heard what you have to say, but they're still skeptical. What do you say to them?
We invite them in, meet our team, meet our doctors, have a conversation about where you are, where you can go, and we just talk through the options. We believe in clarity and honesty and transparency, and so we're there to not try to hide anything and to have a good Midwestern conversation about, where are you, where could you go, and what would those outcomes look like? What would they feel like? What could that do for you as a person?
Okay, so it's a free consultation.
Free consultation.
They come in, and how soon from the time they get in your door can you tell them, we could do this?
That same day, if they were ready to go, we can take them through the records appointment, which is already step 2.
Like measurements, things like that?
Measurements, yeah. We've got a smile design app that we sit next to the patient and we can design their smile.
Is that right?
Everything is digital nowadays. It's all guided and it's all.
So they get to see what their teeth are going to look like ahead of time.
They get to see exactly what their smile is going to look like ahead of time. It's so powerful.
What do they say when they see that? Do they go, I want that?
Yeah, it's a powerful. The ability to see something helps you realize where you're headed and it helps them get excited about what the outcome is going to be.
Now, I know you're a guy with big goals because we've talked a little bit about this even in the green room. Do you think you could wipe out dentures in Wisconsin? Yeah. Is that your secret goal? Because we said, look, the go-to person in Wisconsin, is that one of your goals? To be like the premier center?
I mean, that would be outstanding.
Implant dentistry?
That would be, yeah, that's our goal. That would be outstanding.
So they like getting it done in one place because nobody likes going to the dentist. No, do you hear that, by the way? No offense, doctor?
Yeah, good. People will tell us that all the time, that they're like, listen, I don't want to be here. But they recognize that it's important for their health and that their smile, and so they're there, and they want to be taken care of then by that team that they trust and know that we're going to take great care of them.
Is your secret goal to kind of win them over when you could tell that they're...
I love that. I love that challenge. I love if somebody comes in and they're like, listen, I don't want to be here. I've been treated poorly. Maybe sometimes they're in tears because of their previous experiences, and I literally will sit in front of them and tell them, we're here to unwind all of that and establish a whole new set of expectations of what does it mean to come to the dentist? What should that experience look like and feel like? What should the relationship be? Why would you want to bring all of your family and friends here? And so that's what we love to do.
Do they ever say, like, Doc, when it's all done, you gave them new teeth, upper and lower teeth, do they ever say, Doc, you've changed my life? You hear that?
They say it all the time. But then we like to tell them that it was their decision. They're the one that made the decision to go down that road and change their teeth and change their life and change their sense of self. So they'll thank us, and we just turn it right back on them and just tell them that it was all you the whole way.
Do you see the future of this? Like, do you ever see husbands and wives, partners coming together? They both get it done.
I do, and it's interesting. One of the guys that we did this for, his name's Gary, and he came in, and it wasn't until I was sitting next to him at the end, we're looking in the mirror, and he said, you know what, my wife is going to love this. I haven't smiled in photographs in 27 years. And I said, you got to be kidding me. In 27 years, you've been married, you have never smiled. He said, no. And so that night, I got a text message from Gary, and it's him taking a selfie with him and his wife, full big smile.
This is great.
That's a life-changing outcome for him. For him and his wife, for the rest of their life, they're together. He's smiling, and he never smiled before. So.
Okay. Well, look, we're out of time. I want to thank you for coming on the show. What's the best way to make an appointment? Do they go to your website, make an appointment there, or just call your office?
Either option is totally fine. They call the office, they go to the website. There's a lot of information on the website about this process, about our team, about our organization. So any option works.
Okay. Dr. Cochrane, thanks for coming on the show. Good stuff.
Yeah, thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.